Former President Kgalema Motlanthe will join the civil society sector of South African, or rather of the South African National AIDS Council, SANAC, to launch Splash for Hope. It is an HIV and AIDS national fundraising drive. Now, civil society organizations across the board say they are experiencing a funding crunch, and that is seriously hampering efforts to go about implementing the national strategic plan for ending HIV and AIDS by 2030. We're joined by the chairperson for the Civil Society Forum, accompanied by Dr. Kgalema, Acting Chief Executive Officer at SANAC. Good morning to you. Good to see both of you.
Good morning. Thank you so much for the invitation.
Thank you so much for coming through. Now, it looks like finances are actually part of the bigger problem that civil society organizations are actually facing.
Indeed. I mean, for so many aching years, civil society sectors in SANAC have been calling for resources, particularly for local groups, so for CBOs, for faith-based organizations that are working in the communities. Of course, we all know that activism, we all know community health workers are the backbone of the response, the HIV epidemic and TB response. So part of what we're calling for is the support for continuation of this work that has been done by sectors.
All right. Dr. Kgalema, remind us of the content, of course, and the importance of this national strategic plan of ending HIV and AIDS by 2030 before we talk about the Splash for Hope.
It is very important for us to understand the National Strategic Plan because it gives us a roadmap of how, as a country, we should be responding to HIV. And we have got bigger aims of ending AIDS by the year 2030. And in the NSP, which stretch over the period of 5 years, we have got specific goals that we have set for ourselves with the consultations that we had with the rest of the country to give us direction as to how we should be responding to HIV, to address the issue of the current challenges that we are facing with respect to HIV. Number one, being the high infection rates among young women and girls between the ages of 15 to 24. And then secondly, the NSP is also trying to address the issue of making sure that people also prevent themselves from getting infected. They should also make sure that they get treatment. And then we also aim at making sure that people adhere to the treatment that they get. So we have got about 8 goals in the NSP that gives us direction about how we are going to go about dealing with both HIV and TB as well as sexually transmitted infections.
So the plans are there.
The plans
Some of them are implemented. But the response, because obviously it goes back to the people, the South Africans as well. Are they responding to that, Mapaseka?
Of course, South African people are responding to this. SANAC is a multi-sectoral institution. It brings government, civil society, private sector together. And part of why it will be necessary for people to respond, at the local level, we've got different spheres, national, provincial, district, and local. Where implementation of the NSP will happen, it will happen at the province to local level. It can't happen at national level. So people are responding through sectors. Civil society have 18 sectors: men, women, children, lesbian, gay, bisexual, transgender, intersex, sex workers. So we have got a diversity of community that people are coming together, organizing, and have been doing that for so many years to say we are part of the response. So what we're calling for, in fact, as part of this NSP, to say it is in our hands to respond, and that's why NSP is very important.
Yeah, no, there's so much to talk about. Now, back to Splash for Hope, Dr. Kgalema. What is it? What's this initiative all about?
This initiative is meant to address the issue of shortage of funds, especially for civil society organizations. At the grassroots level, that are the ones that are doing.
Why are these organizations running out of money? Maybe I should give that one to you.
Number one, and then she can add.
She can add, yes.
Number one, there has been a withdrawal of funding for civil society organizations. And then it has become time for the country to take responsibility for funding itself and not be depending on international organizations. We need to take heed as a country and the challenge of responding ourselves. And that responding for ourselves, we know that civil society, they are the ones that are doing the work on the ground. But they need support from the private sector, from government, from ordinary members of society to be able to raise those funds at whatever level, so that we don't always have to depend on other people when we ourselves, if we say we are responding as a country, we must also take responsibility for also funding this response that we are talking about.
All right, would you like to add on that?
Yeah, I think, what's important, there are key activities or interventions that civil society organizations are doing. So it's not only just about providing services where there are gaps, where government can't meet. Things like holding government to account, it is the role of civil society. Things about, ensuring that you play a supportive role, adherence club or adherence management, support to communities. Those are activities done by civil society. But what we're seeing is that the funding stream that comes into the country or that the country is investing in, it's only services that speaks to commodities. But the substance of the work that is also done by community organizations in terms of support, in terms of advocacy, is the work that is not supported. It's the work that makes civil society space to shrink, because it's about accountability ultimately. So what Connie is raising here, we've seen new infections still raising, even if ultimately there's a decrease, but the timeline of that still questions us in what we're doing. We've seen a lot of people that are put on treatment. Minister of Health have launched the universal test and treat. So which means if we've got 7 million South Africans that are living with HIV, currently we've got 3.4 million who are on treatment, we still need to put more people on treatment. It is going to be civil society that has to generate demand for services, demand for treatment.
So how do we as ordinary citizens become part of this initiative?
Splash for Hope, this initiative is calling everyone, every South African. We're calling it the dunk or donate context, where you're looking at innovative way and the fun way where you get the message across, but also you bring back home to the message itself. So ordinary South African can go, whether on social media, can go on the website, just going on Splash for Hope. But there's also a number where ordinary South Africans can come in, which is 36. So you SMS Hope to the number 36239.
All right.
This is the number that ordinary South African can contribute if they are not involved in other activities.
So we should thank or donate. We'll leave it at that. Thank you so much for coming through. Thank you very much indeed. Well, Splash for Hope is an effort by the South African National AIDS Council, like we said, as well as civil society in this area to raise funds in the fight against HIV and AIDS. So if you want to help, you can contact them, as Mapaseka was telling us. That was Mapaseka Litike. She is the chairperson of the Civil Society Forum, and we're also speaking to the acting chief executive officer at SANAC, Dr. Let's take a break.